If your child is sleeping with their mouth open, snoring, even if it's just light snoring or no snoring with their mouth open, there's an issue. There's an airway issue that needs to be addressed, that needs to be looked into, because it's going to impair how that child's facial and bone structure actually develop. Children that are going undiagnosed that have these issues that showing up in small increments that parents think, oh yeah, it's normal, or oh, it's normal that he has ADHD, he's a boy, or
He's just very quiet.
yeah, oh, they're just not a good sleeper. Those are issues that need to be looked into further, because if it's an airway issue, if they can't breathe through their nose, if they have a tongue tie and their mouth breathing, if they have a low tongue rest posture, if they're sleeping in weird positions because their airway is collapsing when they're sleeping in traditional positions, so they tend to sleep in these really weird, strange positions that parents may think, oh, that's cute, let me take a picture of that. It's a sign that this child may be struggling to breathe. And if it's not caught early enough and development keeps continuing, what ends up happening is the face starts developing longer, the mouth, the chin more receded, forward headrest posture, because this is the body learning how to compensate when the muscle function isn't performing the way it should, because you need to breathe. Whether you can breathe through your nose or you breathe through your mouth, you need to breathe. So in our practice, where we have a full team, pediatric dentists, hygienists who I've personally shown them things that I know that we weren't educated in school, so that they're able to recognize this when they're looking into a patient's mouth 40 minutes, 60 minutes at a time. We're looking right down into the patient's airway and recognizing the signs that that person may be struggling or that child may be struggling, and knowing that we can help, that we offer those services. I mean, it's important. Our pediatric dentist is now intervening and having conversations with the parents. And sometimes they're tough conversations because the parent's not ready to hear that yet.